I would like to introduce you to Denise Bouyer-Hargrove. Denise is going to talk to you about including all children, today's presentation, which is the second in the series of our webinars. Denise has many years experience in including children and working with centers, and she has a wealth of information on how to include children in centers and family child care providers. So without further ado, I welcome Denise Bouyer-Hargrove.
Good morning, everyone, and welcome to our webinar today. Today I want to talk to you about including all children. And, many of you who are child care providers understand that child care in the state of New Jersey supports parents to work and provide a living for their family. So it's important that we keep in mind that child care is essential for all young children in order for their families to better provide and support their families. So without further ado, we're going to jump on into the webinar. I have a lot of information I want to share with you today. So as Marie mentioned, you will get a copy of this presentation, which is packed full of information. So those of you who've been on webinars with me know that I tend to give you a lot of information because my philosophy is I would rather you have it and not need it than not have it. So you will have a wealth of information in this webinar to review. So these are some of the learning outcomes today. So my goal today is to help you to understand that child development varies across age spans. Also increase your knowledge and understanding of the laws and policies that support inclusion, as well as identify strategies and resources to help your program to meet the needs of young children, and also give you a better capacity to have conversations with families whose children have special needs and disabilities and guide them into resources. Now, this is a huge topic, whenever we talk about resources and information for parents and rights of parents. So I'm going to highlight some general information, and as always, you can always reach out to the project for additional information. So I first like to begin by talking to you about child development. So we can view child development as one of these two pictures of an iceberg. We can see that, like an iceberg, what we see on the top doesn't really identify how large, how big, or any of the real characteristics of what an iceberg has. We only see maybe this beautiful piece of ice sticking up out of the water. So we can look at child development as that, in that light. We know that all children have unique needs and development, and that sometimes development presents opportunities and challenges. As infants develop, we see new challenges may emerge, and we can see that it can take many different forms. So when we view children as not just what we see on the surface sometimes, but also what could be lying underneath, because their bodies and their minds are still developing. And we can tell that sometimes behaviors that we see in young children, it might cause us to have concerns, but below the exterior or the surface are underlying precipitating factors, that are happening within the environment, that may be happening in a child's life, or maybe just developmental concerns that children are experiencing. Sometimes it displays itself and we see it. So we know that child development can take many different forms, right? We also know that no two children in your program who may be of the same age are at the same developmental level, right? We know that through developmental milestones, we know that some development can be predicted. We know that children who begin to roll over will eventually learn to crawl, or will eventually learn to walk, and so on and so forth. We know it can be predictable. So if we know these things about young children, help us to better care for all children. It's just that when we see certain behavior or certain development that is not typical, those are red flags and warning signs to us that maybe we need to explore this development a little bit more. Maybe we need to do a little bit more study and just carefully watching young children to make sure that their development is progressing as we predict. Okay. So I just want you to take a look at this slide here, because this is an image that was produced by the Cambridge Center out of Massachusetts, and it was printed in the university's press. And what this shows is brain development across ages. Okay, it is also brain development that allows children to be able to listen, concentrate, controls one's impulses, and problem solve. So we can see that new connections are formed through interactions with young children and their families and caregivers, as we can see of the brain development in a newborn in a first month and a 9-month. So we know that, for example, when a baby cries and is picked up, a connection is made. Each time you pat a baby's back, feed them or walk them to new places or take them to new places, connections are formed. So we can also see that a 2-year-old brain uses up twice as much energy as a typical adult brain. So the work and development of infants and toddlers, it can be exhausting being a baby. So we keep in mind that children, as they develop, their brain is steadily making these new connections, and that it's important that young children get plenty of sleep so that their bodies will have time to provide the energy that their brain connections are creating. So one of the things we need to take away from this is to think about how we are helping young children to make new brain connections. What are we doing to help foster those development? We know that relationships with young children is really critical in helping their brains to develop and helping them to self-regulate. So if we know that is true, we know that is true for all young children, including those children who have special needs and have development that is not typical. So our government understands that, and they understand that because there have been several different types of legislations that have been passed throughout the years that help support inclusion. And so when we talk about inclusion, we're talking about working with those children whose development is not typical, those development that may be a little delayed or behind their peers. So we see that legislation that supports child development and young children who have disabilities dates all the way back to 1973. And we see that even up until as recently as 2004, these laws have been reauthorized or improved to meet the needs of our society. Okay. So, but today I want to focus in on these 5 areas of the law and policies, and specifically the first one, the Americans with Disabilities Act. Okay. So children who have disabilities that is not typical, that have developmental concerns, there are certain provisions in the law that provide supports for them and their families, as well as providing services. So for those of you who are not familiar with the Americans with Disabilities Act, it is what we call the Public Accommodations and Reasonable Accommodation Statute, and it covers children from birth to death to adults all the way through their lifespans. So there are provisions in there that requires that reasonable accommodations be made for these individuals who have special needs and disabilities. Whereas the 504 Vocational Rehabilitation Act and childcare is that part of the law that specifically addresses childcare. There are certain sections in the law that addresses other areas, but we're going to mainly focus on the 504 Vocational Rehabilitation Act and childcare that will help you understand why it's important to include all children. Now, the other 2 laws, the Individual with Disabilities Act Part B and Part C, that deals with early intervention and preschool special education programs within school districts. I'm not going to get too much into them today because I want to talk about the law that really helps you to understand why it's important to include all children. These 2, the Individuals with Disabilities Acts Part B and C, these are laws that provide funding to states to help them to promote inclusion and promote services in natural environments through services that eligible children may be entitled to. Now, New Jersey laws against discrimination, they are basically an offshoot of ADA because they are really grounded in the ADA, but New Jersey laws against discrimination are more stringent than the laws against than the laws of the Americans with Disabilities Act. They're more strict, I should say, than the laws of ADA, in that they go far and above what the federal ADA says should happen. So ADA here in New Jersey is exemplified in the laws against discrimination, New Jersey laid laws. Okay. So in talking about the Americans with Disabilities Act, okay, it's important to understand that it's illegal and it prohibits discrimination against individuals who may have developmental concerns. And sometimes discrimination can be disguised in ways that are not so blatant. So it's not so blatant that if a person walk into a program and immediately people, staff in the program automatically sees that this person has a disability, and they automatically or instinctively may prohibit the family or person from coming into the program through various different ways. For instance, I've had situations where families have completed an application for enrollment and have completed a section that says there are some special concerns about their child, and a staff member reading the application may immediately hand that back to the parents and say, well, we're not equipped to handle children like that. We want to be careful not to do those types of actions because they are discriminatory. Okay, so one rule of thumb is you must accept children into your program first to see whether or not your program can accommodate them, and then decide with the parents, in concert with the parents, decide if that's the appropriate placement. So it should not be a decision that is made arbitrarily by the program itself. Okay, so ADA prohibits discrimination in a lot of different areas. So one way to think of it is basically anyone or any organization that opens themselves up to the public, ADA covers that program or covers that organization. So we see here that ADA prohibits discrimination in education, and that includes childcare programs. It prohibits discrimination in employment. There's a separate set of laws and guidelines that pertain to employment and other areas. So it pertains to places like airports. It pertains to places like libraries and malls, and anywhere you would see there's a public gathering. ADA covers those places in stating that reasonable accommodations must be made. That's why we see ramps and rails and recessed sidewalks and things like that within our community. Okay, so when it comes to children with disabilities, and that's our focus of discussion today, okay, ADA prohibits any discrimination against an individual who may have had a disability, developmental concerns, or impairment. And the law is listed and stated as impairment. And an impairment is a condition that physically and mentally impairs someone and substantially limits one or more of life activities. So it could be something as like wearing glasses or a hearing aid that a person who have hearing deficits may need. It may be something as obvious as braces that would help a child to walk and help their bones to develop and support their bones. So it could be any one of those things. Also, ADA prohibits discrimination against people who we think may have a disability. So if we think there's a child in our program whose behavior is such that we think, oh, there's something going on, and maybe there needs to be an evaluation, or the parents need to talk to the child's doctor, that individual is is covered under ADA, meaning that we have to make reasonable accommodations to help that child to be in our program, to benefit and to participate in the different services that we offer. And then it also applies to anyone who has had an impairment or developmental concern or disability, but they no longer have it, or the condition may be in remission or regression. Okay, so for instance, if a child who's born with some type of substance addiction, they may not be displaying signs that that condition inhibited their life in some way, but as they get older, we may see that. So that person is still considered to be covered under ADA, whereas reasonable accommodations should be made for that person. It's not so much saying that we should allow people who have disabilities to do anything they want and act any way that they would like to, even at the harm and jeopardy of other people. No, that's not what the law says. The law is stating that we have to make reasonable accommodations to include them in areas where they would typically be if they did not have a disability. Okay, and so when it talks about reasonable accommodations, I'm going to get into some examples of what that looks like. Okay, but it basically starts with what you're doing right now. Similarly to what you're doing right now, that is learning more about how you can be responsible and be within the guidelines of the law and to do what the law is advising all of us to do, to make reasonable accommodations, not to make overt accommodations and not to make accommodations that changes what we do, but accommodations that can be reasonably made. Okay, so I'll talk a little bit more about them, but I first want to get into some of the things that ADA prohibits. Okay, so here's a list on the right side of your screen of some of the areas or some of the activities that ADA prohibits. Okay, they state that it's illegal for a program to exclude someone based on the fact that they think their insurance rates may go up, or if the child has allergies, or if the child has developmental delay or mobility problems, or this is what I've seen many times, that programs have age restrictions that limit children from coming into their program who are not toilet trained. ADA prohibits that. So if a 3-year-old or a 4-year-old or even a 5-year-old is not toilet trained, that is not a reason to exclude that child from your program. ADA states that you have to provide reasonable accommodations to allow that child to be in your program, and there are certain procedures you can set up to help teach that child toileting or help that child to be able to identify when they have toileting needs and to teach them about what it is that they should be doing and how to do it. Okay, so that's just one example of these. Well, these are just some of the examples that ADA says you should not prohibit. Okay, the ADA prohibits, that says you should not do. So what does ADA require? Okay, so here's another list of things that ADA suggests that child care programs do, that they must provide families and parents whose children have disabilities an equal opportunity to participate in their program. Okay, it also requires that child care program accept and serve children with disabilities. Okay, and it also requires that program make reasonable modifications to their policies and to their practices to include children who have disabilities in their program. And this may look different from program and center to center, how you make your reasonable modifications and accommodations. And I'll give you some examples a little bit later, but I wanted to lay down what some of the specificities in the law are, so so you're aware of them. Okay, and ADA requires that centers provide appropriate auxiliary aids and services needed to effectively communicate with children and parents, adults with disabilities. And there are resources here in the state that can help you to identify what those auxiliary aids and services are. I mean, many of our children use iPads now to communicate with the adults in their life. Many of them uses auxiliary, other types of aids. Okay. So these are just some of the examples that ADA requires. Okay. So here's some additional information about what ADA requires. It allows for children to receive medications while they're at their program, and that reasonable care be used in following the instructions of administering medication. It also provides that you have to make decisions based on an individualized basis, okay? And it also provides that you can provide individualized attention if needed. Not to say that you have to assign a one-on-one aid to a person, you have to assign a staff member to a person, but you can provide individualized attention to a child. And the way we do that is by using other types of methods like individual schedules, individual types of instruction to a child who we know may need a little bit more guidance, okay? And of course, it says you have to make your programs accessible for people who have disabilities. Many programs that are in buildings that were built after 1975, the buildings are usually accessible, meaning the doorways are wide enough for someone in a wheelchair. There should be recessed sidewalks or ramps or walkways for people to come into the building other than climbing stairs for those who have mobility issues. And it does allow that service animals be allowed into the program to help a child, even though the program may have a no pet policy. So we get a lot of questions about what if you have a child in a program who have allergies to pet dander, but you have a child in the program who have a CNI dog or some other animal that is helping them, a service animal that helps them. So one of the rule of thumb is if the child is already in the program, then you have to inform the parent of the child who would like to come into the program that there is a service animal in the program. If the child has allergies, you make that known to the family, okay? So there are other questions that arises around this particular part of ADA. I'm going to refer you all to ADA hotline, which I have enclosed in this presentation, for you to ask more specific questions about that particular part of the law. And also, I'm going to give you the link to a document called Commonly Asked Questions about ADA and Childcare. So that will help you to further study and learn more about any specific situations that you may have in your program. Okay. So who must comply with Americans with Disabilities? So who are the programs that must comply with ADA? So as I mentioned earlier, just about every program that opens itself up to the public. So all privately run child care programs, including home-based programs and those that are licensed, as well as those that are not licensed by the state. So like I said, one rule of thumb is anyone who opens themselves up to the public to do business, they have to comply with ADA. Just as all government agencies, all child care programs that are run on government agencies, government properties must comply with ADA. That includes summer programs, extended school year programs, before and after program, Head Start programs, all of them that are on public property must adhere to ADA, meaning that they cannot turn children away. They need to make reasonable accommodations for children in their program. And even some private child care centers that are operating on the premises of a religious organization. So many churches have child care programs. So those programs would be required to comply with ADA. Even religious organizations whose child care program is solely run by that religious organization, if they are accepting federal subsidies, if they accept some type of in-kind support from their local or state government, they have to comply with ADA. Okay, they cannot turn children away. So for even those religious organizations who do not have to comply with ADA, meaning that they don't have to accept all children who come to their program because they may not be a part of their religious organization, or they may just open it up to their religious practitioners, they cannot discriminate against their members. So if there are people within their practice or within their religious organization who have disabilities and their children have special needs, they cannot exclude those children from the program. Okay. So I got ahead of myself. So again, only those centers that are controlled or operated by a religious organization do not have to comply with ADA. But if those programs are receiving any type of subsidies or services through contracts with federal, state, local, and regional governments, they have to comply with ADA. Okay. So the lawful reason to exclude a child with a disability. There are some times and occasions where we have to sadly tell parents that their child cannot be a part of the program any longer. Okay, so there is a guideline and there is a rule to do this. Okay, so once children pose a direct threat or a substantial risk of serious harm to the health of themselves and others in the program, they do not have to be admitted to the program. But that means that they don't have to allow that child to come back into the program. So if a child care program has had a bad experience with a child who has a particular type of disability, and then they say, well, we're not going to let any more children who have that type of disability in our program, that would be illegal, right? So the law requires that you make individualized decisions and that you do not generalize or stereotype within a disability towards all people who have that disability. Okay, so once you know that a child does pose a threat to themselves and other, or can create substantial risk to someone else, the thing to do is to sit down with the parents and discuss this, and discuss ways in which we can teach the child appropriate behavior, discuss ways in which we can help the child to learn another type of behavior than the one that is creating the risk. Okay, another way is you can also seek outside help through additional training, through additional technical assistance on how you can support the family and support the child. The key is you have to document that you have tried to make reasonable accommodation, even in this instance, to help that child to stay and maintain their program. Okay, so it's not that if the child does something that is egregious, like hit another child and causes that child to be bruised, and you know that that child has a disability or a condition that falls under one of the conditions that I listed earlier that ADA covers, then the thing to do is to speak to the parent of the child who was hit. Okay, then explain to that parent that you're working with the family to help the other child to learn better habits, to teach them better habits, better acceptable, appropriate behavior. And you don't breach the confidentiality of the child, but you absolutely assure that parent of the child who was hit that you are working on the situation and you're working with the other family, and ask them for their patience and, of course, apologize for the behavior and the hurt to their child. Then you would speak to the child who caused the behavior and express to the parent that we need to be able to come up with another way to teach your child appropriate behavior. It is not acceptable. You know, it's kind of like you're letting the parents know what is happening and you're creating a plan going forward how to address it. That would be my suggestions on how to handle situations like that. Again, if you have specific questions about that, I would again refer you to ADA so you can get additional information on how to handle that. But I would say that there are organizations like the New Jersey Inclusive Childcare Project who will work with you, work with the program, work with the families on coming up with different techniques and strategies to help teach children appropriate behavior. And we can also help families in guiding them into other resources that can also assist them. So there may come a time when a child might have to be removed from the program after they have been admitted to the program. And if that happens, I would suggest you follow the Office of Licensing guidelines for disenrolling a child in your program. But while the child is in your program, I would encourage you to reach out to programs like the New Jersey Inclusive Childcare Project or others to get assistance on what you can do, what type of strategies you can put in place to help the child while they're there. Okay. So another issue that comes up under ADA is who pays for the accommodations. Okay, because sometimes making reasonable accommodations, it can cost. Okay, so for instance, if a child needs extensive medical treatment and the child care program is not comfortable taking the training from the parents, because ADA does allow parents who are lay people, not the parents who are nurses or practitioners of health, to teach child care program how to administer certain medication and how to administer certain procedures. So it would be illegal for you to charge a parent to do that. But what you could do is you could ask the parents, number one, if they can come in and train the personnel who will be working with their child on the medical procedure or practice, okay, like glucose testing, tube feeding, even catheterization, things like that, that parents can do on their own, okay? Because if parents are doing it, then they can show someone to do the same procedure. Now, if there are complicated medical tests that needs to be done or procedures that need to be done, and just thinking off the top of my head, an example one would be a child who needs to have respiratory therapy done. You know, that is something that a practitioner may have to come in and do. So a child care program may say, well, we're not comfortable doing that. So what we'd like to do is bring in a nurse who will do that. So the child care program can do that, but in order to pay for that, they have to raise the tuition slightly for all of the parents who are participating. And one way you could do that is just post it as a benefit to the parents. Pose it as a benefit to the parents, simply telling them we'd like to hire a nurse to come in and make sure that all of our children are healthy, who will do routine checks for our children, and we're going to increase everyone's tuition by $5, $10, or whatever it is to cover the cost of that. So that's how you would handle certain types of accommodations you have to make, especially if it's an accommodation where it is a complicated procedure that has to be done by someone who is a licensed practitioner. Now, you do not have to do that. You do not have to do that if it's something that the parents are not doing. If the parents are doing it and they can teach your staff how to do it, ADA says that that is a reasonable accommodation. However, if you're not comfortable taking the instructions from the parent and you would rather get that accommodation from a licensed nurse or someone like that, then you can charge all of the parents a slight increase to cover the cost. And if you have a parent who says, well, I know this is a complicated procedure because I have a nurse coming to my house to do it, you could allow that nurse to come to the program to administer the procedure to the child. Or if the parents are paying for a nurse to come to their house and do it, they could pay for a nurse to come to your program to do it. So the key is having an individual discussion with the parents to find out exactly how the procedure is administered while the child is at home. Okay. So as promised, here's the hotline number to the ADA. So in case you have other questions about what type of accommodations you need to make to the architectural structure, or what type of auxiliary aids or services that you need to provide, or where you can locate these items, you know, you should call ADA and they can better guide you on what is the next step. There are programs here in the state. Special Child Health Services can help you to locate places where you can borrow certain types of equipment, adaptive equipment, but that is a resource that you'd have to contact them about and find out more about that. But as I said earlier, there are organizations here in the state that are willing to provide you with information. You can always contact the Statewide Parent Advocacy Network. We are pretty much connected to a lot of organizations here in the state that provide services and support children who have disabilities. Okay, so when we talk about all children, when we talk about including all children, we want to keep in mind, what do we mean by inclusion? Okay, so inclusion is not just someone being in your program and occupying space in that program. As you will see here from this definition of inclusion that the Division for Early Childhood and NACI created back in 2009, it basically describes how inclusion is really a way to help children to access your program and to participate in your program, and the supports that these children will need to get meaningful benefit from your program. Okay, and this definition here has been used to help create evidence-based practices, as well as to create guidelines and research-based practices that childcare programs use today in order to help include children who have disabilities. So when we talk about access, here's some examples of some of the policies and guidelines that you can implement in your program that goes towards access. Having an inclusive attitude about people and children who have disabilities, and using people first language, using language like a child who has a disability, not a disabled child. So we want to speak about the person in first person language first, and then describe what their condition is. Having a written policy about inclusion, more or less stating that you are willing to allow professionals who are working with a child who has a disability to become part of your program and to help support that child in your program, mainly by using services of early interventions, and maybe even a nurse or other practitioners who are working with the child, a behavior therapist or a psychotherapist. So having a policy that states that you're willing and open to working with those professionals who are working with these children also promotes access. Having a discipline policy and procedures that's in line with age and development, and teaching children about acceptable behavior rather than punishing children for unacceptable behavior. Having a policy around toileting and a practice around helping children to understand toileting. So these are just a few of the examples of what early childhood inclusion access look like, and some of the examples that we took from the NACI and DEC statement that I showed you earlier. Okay, so when we talk about participation, so as I said earlier, it's not enough that a child is occupying space in your program. The child has to be getting meaningful benefit. The child should be participating in every activity that is available for them. The child, like all the other children, must conform to the rules of the program, and having simple rules, a few simple rules that you teach children every day. You should be teaching these to children who have disabilities and developmental concerns as well, helping to build relationships through pairing of children as buddies, and having a welcoming attitude towards all children, and letting them know that they are accepted and wanted in the program, and that you are there to help support their needs. And again, here's some other examples of ideas of how we can make accommodations to our program so kids can participate. Having learning material that's readily modified and adapted for children. So having the learning materials on a low level so kids can reach it and be able to access it. Having pictures and descriptions of how to use the material, how to use the object. That helps kids who have some developmental concerns. And sometimes the teacher sitting with the children and exploring the materials with them. I have visited programs where the children are all playing or interacting on the floor in an activity, and the teacher is sitting at a desk, or the teacher is standing up around the children. It's a good idea for the teacher to get in there and play with the children and show them how to use the material, how to manipulate the material, so that children learn the appropriate way of playing with materials, as well as helping them to understand the idea of turn taking and sharing, being a good friend. All of those things children with developmental concerns need more so than children who do not have developmental concerns. Okay. So here are some examples of some inclusive childcare supports that is recommended by DEC and NACI in order to help facilitate inclusion. One would be ongoing screening and monitoring of children's development. And whenever there's a screening that is positive, there are some resources that you can refer families to, or you can even access yourself. Okay, so here's a list of them. I've listed them here for you to have a reference, and also for you to pursue and find and locate additional information on them. So when a child's screening comes out positive for developmental concerns, one of the things we first want to do is talk to parents about that. And then we may be able to refer them into either one of these community resources here. I have a chart later on in this presentation that will help you to be able to explain it a little bit further to parents on what to do when a screening is positive for developmental concerns. So the reason why we say that ongoing screening and monitoring of development is one of the supports to help children who may have developmental concern is because screening is the first step in helping children who are eligible find related services. Many times, children who may have a developmental concern, it may go undiagnosed through a pediatrician visit. It may go unnoticeable to families, especially to first-time moms who may not be familiar with developmental milestones. But those of us who have worked with children for many years, we can identify and can kind of sense and tell when something with a child's development may need a little bit more assistance, right? So screening helps us to do that. And screening leads to assessments, which also leads to evaluations. And evaluations determine if a child is eligible for services like early intervention or special education services within the school district. Okay. So here are some other accommodations that I'm pretty sure most of you probably have this, but for those of you who don't, I just want to highlight how this type of an accommodation could help a child who have issues with finding their place, who may have concerns with, you may have concerns with them being able to locate their place and being able to follow the instructions of an activity like lunch or snack. Okay, so you can see here that these are laminated placements that have a place for the bowl, a place for the cup, and it has a picture of the child who is to sit at that particular seat. So this helps kids from jockeying for positions during lunch or snack time, or even any tabletop activity. So having areas that are clearly labeled for children that describe what they're to do when they get there and who is to be sitting in which place helps to cut down on behavior incidents. Okay. So here is another type of accommodation. Okay, many of you are using visual schedules in your program, but you may not look at them as sources of accommodations to help children to participate. That is exactly what they are. They are accommodations to help children to participate in your program because it gives them an idea of what to do, when to do it, how to do it, and who's going to do it. So with this particular visual schedule, you see the names of the children on the left. You see the activity has to deal with something around computer. It also says whose turn it is. So you see that the child whose name is not listed, 1, 2, 3, is a child whose turn it is. And when that child is done, the name is placed in the all done pocket here. And as the children begin to ascend this list here of whose turn it is next, then their names will go into the all done category too. One of my favorite schedules is a now and a then schedule. It's very similar to this, except that where it would say turn, because that might be something of an arbitrary term that children may not be able to understand. But if you have something that says now it's Mark's turn to sit at the computer. Then it will be Adam's turn, and then it will be Billy's turn, and then it will be Jane's turn. That kind of helps children to understand where their placement is, where their place is in working with this activity. Okay, so here's another example of an accommodation, is to have pictures of the toys on the shelf for which they belong, so that when you're doing cleanup and kids are not just throwing toys and putting toys any old willy-nilly way, you have a cooperative, concerted way in which children can neatly put away their items and put away their toys here. So these are just a few ideas of, you could take them, I'm hoping, and include them in your program or expand what you're already doing, okay? So here's a picture of a young boy using a paper cup to do coloring or painting. So this might be a child who has some pencil grasp concerns, who are not able to use, let's say, a crayon or a paintbrush, but they're able to grasp this paper cut and make circles or make objects that they normally would not be able to do. And it's a fun activity for kids because they're using everyday common objects to do extraordinary things with. Okay, so that's just an example of what an accommodation would look like. So here's the flow chart I was telling you about that will help you in your discussions with families. This is a chart that we at the Statewide Parent Advocacy Network created in concert with the Boggs Center. And what this chart does is it helps you to explain to parents what to do when a developmental concern is identified, okay? So, and we have them made based on county. So this particular one, an example of resources that are in Burlington County that can help families once you have identified that there's a developmental concern through a screening. So first and foremost, you would start in the gray box or the gray spot on the left. Encourage the families to have a discussion with the families about your findings, and then have them to do a developmental screening. Most doctors, they can do a quick developmental screening at pediatric visits. And then so the next step would be, if the child is birth to 3, you may want to make a referral through Child Find to the early intervention program if the developmental concerns are significant, where that on the screening it shows that there is a clear developmental concern. The second thing is, if the child is 3 to 5, you would encourage the families to contact Project Child Find or their local school districts in order to have the child screening further assessed through an assessment or an evaluation to see if the child's eligible for services. So if parents did not want to contact either of the two agencies that I just mentioned, they can always get a developmental evaluation if their insurance will pay for it. Most insurance will. If they can get a developmental evaluation through Cooper University Hospital or the Center for Neurological and Neurodevelopmental Health here in Burlington County. And oftentimes parents can all ask the school district for an independent evaluation to either one of these locations. So there's a variety of different ways that you can talk to families about the resources that are available for them in their county when a developmental concern has been identified through a screening, okay? And the rest of the items on this chart, they are resources that help support families. There are local community resources, family support resources, mental health resources, and then special child health services. So special child health services, case management, they will help families locate even more resources within the county and talk to them about other types of information that might benefit their family, okay? And then last and most important is that you follow up with them. So once you give parents the information, you want to follow up with them and ask them how they are progressing with the information you've given them. Just simply ask them, so how did the doctor visit go? And parent may say, well, my doctor visit went fine. The doctor doesn't think anything is a concern. And you just thank them, say, thank you, I appreciate that. And many times doctors may not see what you see by caring for this child during the day. So let parents know that you appreciate them following up on your advice, and you thank them, and you tell them that, okay, now I know that there's some things that I can work on here in the program. Okay, so your next step would be to try to get training on how to address some of the developmental concerns you saw. Okay, next step would be reaching out to this project, reaching out to your CCR&Rs, because they do provide trainings on development and developmental concerns and strategies you can use with the children in your program. And you can reach out to us. We will come out and do a training with you to help you to be able to find strategies that will work for your program and the children in your program. Okay. So we also have these based on other counties. So if you would like one of a different county, you can just contact us here at the project, or you can also just go onto our website. They are listed on our website. Okay. So in summary, I want you to keep these things in mind when we talk about access, participation, and support. So keep in mind that making reasonable accommodations to children who have disabilities so they can be included is really important for these children to be able to have access to high quality childcare programs that your programs are providing. And you want to provide opportunities, multiple opportunities across the day for children to practice emerging skills and practice some of the skills you're teaching them, because remember, development doesn't stop at age 4, that kids continue to develop after age 4, and helping children to make transitions through different activities and routines and schedules, and expressing their wants and needs, using a visual schedule, helping them to understand what is happening next and helping them to understand the expected behavior, and then also partnering with various community resources that can help you to be able to provide services and support all children in your program. Okay. So we're almost done. So I think I'm just going to, so this is a slide that really just talks about how to build strong relationships with families, open communication, frequent communication, and helping families to understand that you are concerned about the child's development as well as the child's strengths, and that that is that will help alleviate parents' concerns over what will happen with their child in your program. I'm sorry. So on this last slide, well, second to the last, I've included some resources that will help you in supporting inclusive childcare. Like I said, the commonly asked questions about ADA and some other information here I've listed for you, as well as policy statements on inclusion. Here's an example of a policy statement. Actually, this is the policy statement that the federal government issued a couple of years ago on including children with disabilities in early childhood program. Next, I've listed out some additional resources around autism, around early childhood development for you. And lastly, I want you to keep in mind that programs, not children, have to be ready for inclusion. So if you don't have any children in your program who have a disability right now, now is the time for you to start preparing your program so you will be ready for that child when they do enroll. And this is a statement that I took from the authors here of a book called, Including Young Children with Special Needs, where they outline some additional strategies in addition to the ones that I just discussed. So I know it was long. I know it was a lot. I thank you for your patience. I appreciate your time. If you have any questions, I will stay on the line and answer any questions you may have right now. Or if you like, you can always contact us here at the project through any one of these methods here, and we would be glad to assist you. So without further ado, Marie, if there's any questions anyone have, I'll be glad to take them now. Thank you all for participating and staying on the line with me.
So does anybody have any questions for Denise? You can feel free to put them in the chat box or the Q&A. People on the phone, you're more than welcome to unmute your lines and ask questions via the phone. To unmute your lines, press *6. Denise, we have one question from Marissa. What if a child requires a one-on-one aid? Do we have to supply that?
Well, it depends on who's recommending that there is a one-on-one. Oftentimes a child care program may think a child may need a one-on-one because of the behaviors or activities that the child is displaying. So if a child care program feels that a child needs a one-on-one, they have to pay for that. Parents are not required to pay for a one-on-one aid. If a child is in the school district and they have an IEP, individualized education plan, that is a service that the parents need to meet with the child study team and request that the child has a one-on-one to help them in the child care, help them in the school program. Now, the school district will not pay for a one-on-one to come to a child care program if a child has a one-on-one in school. Okay.
Okay, we have a question from Mary Ellen. Is it wise to try strategies if a child is trying to hurt herself?
Well, if the child is trying to hurt themselves and their peers, then the question to ask is, can you teach the child appropriate behaviors so that the child does not harm themselves and their peers? So can you create, let's say, resource material? Can you create, let's say, a social story about hurting your friends, hurting your buddies, and teaching children what is appropriate behavior? For instance, can you create a learning material where you're teaching the child that it's better to how to ask for help rather than hitting a child to take what they want? Those are the things you have to look at. If the child's behavior is persistent and the child is continuing to display that, then you want to make a recommendation to the family to have their child evaluate to see if they can get additional services and supports. If the child is under 3, you might want to recommend the early intervention program for the child to be evaluated, see if they're entitled for additional services. So the thing is, if a child is harming another child and his behavior, the thing is to talk to the parents about determining why the behavior is occurring, because we know behavior is a form of communication. So what is the child trying to communicate through the behavior? If they're trying to communicate that they want something, then you have to teach them the appropriate way to ask for something. If it's neurological and you think the child is acting out because they have uncontrollable behavior or impulse behavior, that is something you would want to talk to the child's family about and maybe have them follow up with the pediatrician about.
Audio.
Explaining what you are seeing and asking the doctor to see if there is an assessment or evaluation that they can do to help you identify how you can best help the child. I'm only describing for you the process in which ADA, the Americans with Disabilities Act, says that you have to follow when you have a child in your program who may have a developmental concern. And you can also let the parents know that you would, if it's persistent and the child is creating a danger and is a real threat to the other children, and it's hard for you to manage the child, and the child is not following with the instructions and the guidance you're teaching them about behavior and what's acceptable, then that might be a reason to tell the parents that they would have to get additional help and service in order for the child to be in the program. And I'm not saying for you to take that as a blanket permission to exclude kids from your program. I'm saying you have to look at what has happened individually with this child, and through your teaching the child using, being very conscious of your tone and your tenor when you're speaking to young children, because sometimes when we see children are acting and displaying behaviors that are not appropriate, we tend to get emotional, and that doesn't help when we're trying to help teach a child appropriate behaviors, right? So if a child has persistent behavior that seems to be impulsive and seems to be not one in which you can teach the child appropriate behavior, it's best for the families to get an evaluation to find out what is causing the behavior and how best to address it. Okay.
We have a couple more questions, Denise. One from Marissa. I have a child with an IEP and has a one-on-one in the morning, but needs one after school with us. Does school provide?
You have a child with an IEP, and the IEP has a one-on-one in the morning, but the child needs one in the after school. Well, school districts will not pay for one-on-one to be in the after school program. They will not do that. But what they may do is, if the after school program is on the school's property, okay, they could have someone, the one-on-one, bring the child to the after school program, help acclimate the child to the program, basically bring the child to the program, explain to them that now they're in the after school program and they will wait in that program for their parents to pick them up, and they can describe to the child the activities in the program, what will happen. For instance, they could describe that the child is to take out their homework and do homework, or take out an activity and or take out their iPad if they have an iPad and do an activity on their iPad, or pick one of the activities in the program. Find an activity in the program that the child is interested in and let the child engage in that activity, and then drop the child off at the program. That is what I have seen school districts do within IEP programs. But it will be up to the parent to talk to the child study team and talk to the principal of the building and see how the school can help that child to be included in the after school program on the school's property. Okay. Oh, if it's not on the school district property, usually school districts will not provide a one-on-one to off-site programs. So if you feel you need a one-on-one aid for a child, I would suggest first getting training to see if there's something you can put in place in your program that will help the child to manage their behavior. Sometimes putting in additional activities, sometimes putting in a schedule, sometimes putting in other types of recreational activities can help children to self-regulate, where they don't need a one-on-one aid. And what would the one-on-one aid do? So if the objective is to have a one-on-one aid who will just sit and watch the child and interfere with the child getting into, let's say, mishap, then maybe we need to look at how we can restructure some of the items in the program to help the child to be able to navigate the program better. Okay. So I gave you some general information, and I'm hoping that is helpful. If you have situations that needs a little bit more support than what I've given you, reach out to the project. Call us at the project, and we'll see, can we schedule an on-site consultation with you and see if we can come into the program and observe the child in the program, or observe your program and make some recommendations to you. Okay. Sometimes we've been really helpful with programs who feel that they need a one-on-one aid by simply helping them to make small modifications in their program. And sometimes we haven't been, but we'd like to have the opportunity to help you if you feel you'd like that type of assistance. Okay.
Denise, have you seen Sophia's questions? One of her students was diagnosed with autism spectrum disorder and qualifies for services to the public school district. I work at a private childcare center. His parents are concerned that he's going to regress in the special ed program because he'll be surrounded by nonverbal children who are much higher on the spectrum than he is. They feel he's better off staying with us and paying for an ABA therapist to come and join him at our center. So do you have any advice on what the parents can do?
I can't see. Oh, okay, now I can see all of Sophia's question. His parents are concerned that he is going to. Well, if the parents have concern, have them call the statewide parent advocacy network and ask for technical support. Okay. And you didn't say how old the child is. If the child is under 5, you can have the parents contact the project, and I'll be glad to assist them with how to next approach the school district. But if the child is over 5, have them contact the statewide parent advocacy network and ask for technical assistance on this particular topic. Okay, because this is something I cannot advise in the time we have online right now. Oh, I see. He's 4. He'll be 4 in January. Sophia, do me a favor. Copy paste your question right here and email it to childcare at Stand Advocacy, and I'll be able to address you with a little bit more detail in that email. Okay. Alrighty. Well, I thank you all for staying with us and your questions.
No more
Okay.
questions, Denise. I think
All
we
right.
covered
I hope
everything.
you all have a wonderful day, and